Singapore's level of COVID-19 is classified as unknown by the US along with North Korea and Afghanistan. National Badminton Chief Coach Mulyo Handoyo is stepping down after guiding Loh Ken Yew to a world title. And to help you kickstart the new year, we've got some healthy tips for you in living well. Welcome to The Big Story. I'm Olivia Quay. You can subscribe to the Straits Times channel so you never miss a single episode. The Health Ministry has launched a police report against anti-vaccine group Healing the Divide over plans to disrupt operations at pediatric vaccination centres. According to its Facebook post, MOH is aware that the group has exhorted parents through its Telegram channel on December the 27th to visit these centres to overwhelm on-site medical staff with questions. The ministry says such an act will greatly disrupt operations and amount to an instigation of harassment of the medical staff. It's a very serious matter, and MOH says that's why it's made the police report. Meanwhile, questions are being raised about why the US has moved Singapore from level 4 to the unknown category in its COVID-19 travel advisory for Americans. Here's the page on Singapore, where according to the Centres for Disease Control and Prevention, there's an unknown level of COVID-19 in Singapore. CDC advising Americans to avoid coming here, saying that because the current situation is unknown, even fully vaccinated travellers may be at risk of getting and spreading COVID-19 variants. With this reclassification, Singapore is now in the same unknown category as Afghanistan, North Korea and Syria, with CDC saying that if a destination doesn't provide data, its level is designated as unknown. Well, Singapore's COVID-19 situation looks like this. 842 new cases as of noon on Tuesday, comprising 304 in the community, 6 in migrant worker dorms and 502 imported. The latest numbers are available on the main page of the Health Ministry's website, moh.gov.sg. Meanwhile, the weekly infection growth rate yesterday was 1.09, the first time since November 12th the figure has gone above 1. It's also the 11th straight day that it has increased, with it being at 0.95 on Monday and 0.92 on Sunday. Last month, an infectious diseases expert explained to The Big Story why the weekly infection growth rate will trend towards 1 as the COVID-19 situation stabilizes.
So if the numbers are low and stable, then the weekly infection growth rate should be equal to 1. You can see why if you think of, imagine that we've passed through the wave, we've not reopened any further, we've got 10 cases a day. If we've got 10 cases a day this week and we've got 10 cases a day next week, then that means we're in a stable situation. The epidemic's not growing or shrinking. The growth rate is 1 at that point because each case this week is matched with 1 case the following week. But that situation, although it looks bad because the growth, when you look at the growth rate alone, actually is a better situation than we're in at present, where the growth rate is below 1, but the numbers of cases are in the hundreds. And that's because the absolute number of infections is smaller. And more generally, the typical shape of an epidemic is like a bell curve. The growth rate is high when it's on the way up, it's above 1. When it reaches the peak of the epidemic, at that point, the growth rate is equal to 1 because the case is 1 week before the peak. 1 week after the peak is the same on average. But as we pass that peak and we start to come down again, then that's when the growth rate is going below 1. But at some point, the growth rate is going to get shallower and shallower as the epidemic flattens off. And that's why the growth rate doesn't really matter so much when you get towards the end, because the cases are so small that it doesn't matter if the growth rate has now gone back to 1, i.e. at that replacement level.
Retail sales here rose for a third straight month in November, although growth slowed from the previous month. Takings at the till rose 1.9% year-on-year, moderating from the 7.5% growth in October, which was skewed by new product launches like Apple's iPhone 13. Singapore's national badminton chief coach Mulyo Handoyo will step down after a 3-year stint that runs out on February the 4th. Most recently, he coached Loh Kian Yew to a historic World Championship title. Loh says he's saddened by his mentor's decision, but wished him all the best. Quote, "Coach Mulyo has helped me become a better player, sharing a lot of his experiences with me and teaching me the importance of consistency." Still in sports, Novak Djokovic is facing a major backlash after receiving a medical exemption for the Australian Open, made worse by the fact that tennis bosses aren't able to provide the exact reason why the world number one received the exemption. For months, Djokovic has refused to disclose his COVID-19 vaccination status.
It's very clear on what conditions you would receive an exemption on. And to briefly, quickly summarize those, one of them is obviously having an adverse response to any kind of vaccine and having something like an anaphylactic response. Another one is if you've just had major surgery and may or may not be suffering from myocarditis. And another one is you're a recovered case. In other words, you've had evidence of COVID and certified evidence of COVID over the past 6 months. So I think it'll certainly be helpful if Novak was to explain the conditions which he's sought an exemption and been granted an exemption. And we're just not in a position, even legally not in a position, to disclose other people's medical information. It's ultimately up to him. And yep, I will encourage him to, to talk to the community about it.
A new year is often seen as a fresh start, and for many people, both young and old, it's the perfect excuse to begin a new diet or fitness routine, or to make changes in their lives and feel better for it. Well, here's what experts recommend that we all do to achieve a healthier lifestyle. First of all, it's important to eat right, exercise sensibly, and rest well. Apart from that, they also suggest investing in preventive health measures, managing your mental health, and most of all, enjoying what you do. Well, let's get some tips from a senior physiotherapist at aged care provider Allium Healthcare, Nicole Lu. Thanks for coming on the show, Nicole. So, because it's never too late to start for any of us to make changes and adopt a healthier lifestyle. So Nicole, what are some of the best physical activities that seniors can do? Activities that are simple yet effective.
I would say there's no one-size-fits-all kind of a physical activity, because what works for you may not work for me. But when it comes to seniors, I would suggest that they pick an activity that encompasses components of strength, components of cardiovascular, components of balance, because these three components of health or fitness will eventually help to prevent things like frailty, prevent things like falls, injuries, and hospitalizations. So it can be as simple as going for a walk or just increasing the walking distance that someone has already been doing. Just a little bit of activity would help in a long-term maintenance in terms of the functional status of a person. And I would say it ranges from brisk walking all the way to lifting weights. All of these activities have merits and evidence that shows it improves bone health, it improves cardiovascular health. So take what you are more likely to participate in, more consistent in, and your motivation level is of consistent at where you are likely to participate at least 2 to 3 times a week. And it doesn't have to be something strenuous. It has just got to be consistent and of a comfortable intensity. And you'll find that your body will feel better after a few weeks.
Well, Nicole, let's talk about the enjoyment factor. How important is it that seniors enjoy what they do, whether it's an activity or a hobby, and so that they're not just going through the steps just because they have to?
It's so important because as physiotherapists, we are always talking about the physical aspect of how much they can walk, how much they can stand. But there's so much more to an activity that a senior should really consider. Take, for example, marketing. For us, it comes naturally. We just go to the market, we get things. But for them, it's about what time to get up, what bus, who you're going to meet at the market, taking control of your money, And it's the stimulation of the five senses when you're going to the market. You know, you're going there to eat your favorite food, you're going there to meet your friends. There's the social element of it as well. So it gives them a sense of purpose in life. It gives them a sense of belonging and identity that this is part of their lifestyle and the independence that they look forward to. So we don't want to take that away from them, especially at a senior's age. So all of this, besides the physical aspect, the mental and mind body business is just as important. Yeah.
For sure. Well, what are some of the exercises that seniors can do to improve their strength and flexibility? Well, Nicole has filmed a set of exercises for us. Let's have a look.
So here are 3 simple exercises that seniors can do to improve their lower limb strength. The first one is the sit to stand. So you will require a chair. Okay? So you're facing front, toes are pointing forwards. Your hands, you can have the option to put across your chest like this to make it a little bit more challenging. And all you're going to do is you're going to sit onto the chair and you're going to use your legs and stand up tall. Ideally, you should be doing this for about 12 times and a total of 3 sets. So that's the first exercise. Okay. Your second exercise is what we call a side lunge. Okay. Hands on the chair for support. What we are going to do is we're going to open up with the outer leg to the side, toes pointing forwards, a little bend at the hips, not too much at the knees. You should feel a little bit of tension in your hips and you're coming back up. And you have the option to do it on the same side for a set of 10 repetitions. When you're done with 10 repetitions, you may go on to the right side. Similarly. So this works your glutes muscles and it helps you with walking, helps you with climbing stairs, getting up from the bed, things like that. So that's your second exercise. Ideally, you should complete a total of 3 sets of 12 repetitions. Lastly, you should find a step or a curb in your house or a staircase. Any of this of any height would be a good start. Always use the chair for support. Place it near you so you have the confidence to continue doing the activity. Hands on the chair, and when you're going to do, you're going to start off with your left leg or your right leg, whichever works best for you. You're going to step up, fully straighten your knees, and we're coming back down with the same leg. Same, we should always work the same leg about 1 set of 10 to 12 repetitions. Okay. And then when you're done with the left side, you can continue on your right side. Ideally, 3 sets of 12 repetitions on either side. And that's the end of the 3 simple exercises that you can do.
Well, that was Nicole Lu, Senior Physiotherapist at Allium Healthcare. Aside from staying active, a healthy start to 2022 also means eating well. We have some tips on that and how to make healthy changes to your lifestyle at str.sg/living well. Visit straitstimes.com for more news and our YouTube channel for more videos. Subscribe by hitting the red button below. I'm Olivia Quay. See you tomorrow on The Big Story.